Technology is very important. People don't have regular access to broadband internet. People don't have access to affordable computers or software. They are not educated in technology, or they sometimes don't even understand the value that technology brings in their day-to-day life. Mayor Daley cares about bridging the digital divide. Back in 2006, he appointed this Council of Civic Leaders that looked at the digital divide across the city of Chicago and came up with the actionable measures that could be taken to overcome the digital divide.
Each one of the organizations that made it to the finalist stage, it has exponentially increased the number of people that they're serving, the depth of the services that they're giving, and treating their clients with a lot of respect and dignity. And so for us, it actually is more than just the innovation of technology, but it's more about the effectiveness and the efficiency in which they're able to do that.
The Corporation for Supportive Housing helps people who don't have homes get homes, and we really focus on helping people who need more supports to stay housed. So people who have mental illness, who have substance use issues, or other barriers that have made it hard for them to get housing. The Housing Options tool is a really creative, effective tool that makes a difference in the way communities spend their money for people who are homeless. It helps them access housing and find it easily. If you think about, families who are homeless and the difference between living in a shelter and moving into an apartment where you have regular schools to go to and you have more support and the ability to keep your own groceries and healthy food in a refrigerator versus, communal meals in a shelter program, it makes a huge difference. We're extremely grateful for this opportunity. Think that the possibility of this allows us to expand our work and broaden it, and really appreciate the support to make that possible.
Erie Family Health Center is a community health center serving the west and northwest sides of Chicago. Erie's mission is to provide comprehensive, affordable primary health care regardless of the ability to pay. What we did at Erie Family Health Center was to completely replace the old-fashioned paper patient chart with a completely electronic patient chart. It allows us to improve quality by analyzing our patients' information and using that information to improve what we do each and every day. Electronic health records is a perfect way of accomplishing that goal. And if I can do something as an individual with my organization, I'm going to help Chicago be a much better place for people to live. Thank you very much for this opportunity.
Our primary focus, is the way it always has been, is to be able to provide resources to low-income and immigrant families. We also have a family support program. Our food pantry supplies food to residents in the Westtown community. The way we used to do our intake was through a pen and paper and one employee. Due to the volume of people, it just wasn't working out anymore. We've been able to meet that demand now. One of the great things about technology now is that, especially for nonprofits like our own, it really democratizes the process, and it allows us to be able to do things that we wouldn't have been able to do 10 years ago. I think that one thing that people don't realize, and I see it every day, are the faces of hunger. And the faces of hunger aren't always the people that you would necessarily expect, especially now. There are a lot of people that have just gotten down on their luck, and they've run out of places to go. And you can see on their faces their reluctance to seek these things out because of the pride that they have. And yet the fact that we need to eat. And despite the fact that we still live in this enormously wealthy and advanced country, that hunger issues still persist. Using our services reaffirms why we're doing what we're doing.
We do outreach, engagement, linkage, and case management with people who have a severe and persistent mental illness and also who are homeless, often chronically homeless. The technology's been incredible. It's been a boon when we're out talking to a homeless man. Rather than being in transit back to the office to get my internal documentation done, I can spend more time with him, and then when we finish up, I can do my internal documentation right there. Recently, a coworker of mine and I were together doing outreach, and she received a cell phone call from one of her clients who made an effort to call her, and she was in crisis, she was suicidal, she was crying, and she would not give her location. Being able to shoot emails back and forth, what does she look like, where is she, and not having to hang up on a person in crisis was incredible. This client was able to be picked up by the police department, and we met her at the emergency room, and it potentially saved her life. It's joyful to be able to assist someone. Individuals who have mental illnesses are just like anyone else. They have hopes, dreams, and fears. Acknowledging them could be the nicest thing that's happened to them in days. That's a person in a terrible circumstance, so just showing them the respect of acknowledging their presence could mean a lot to them.
And it's really thrilling to see what these organizations can do to change the trajectory of how they're helping people, many times with very modest to very minor funding. We love connecting with local organizations. So for Chicago and its Evolves Technology, we like being involved and helping the community. Lumity, Accenture, helping Chicago, that's what we like to do here in Chicago.
What is really exciting about Lumity is that it's because of the technology services and the financial services that we provide, we are helping each and every one of those organizations be more effective and efficient, and hopefully increasing the number of people that they're serving and having a greater impact.
And our job as the city government, in fact, I would say our job as the civic leaders gathered here is to bridge that gap and make sure that those that don't have access to technology eventually get access to the technology.